This is the second part of the assessment, and this time we're going to use the mannequin, and we're going to be assessing the lungs, the heart, and the abdomen. So we've already done the preliminary identifications. Now, what you want to do with this is definitely provide some privacy because you're going to be exposing them. And I'll leave this pulled up till I actually get ready to do the pulse checks, because right now I would explain to them that I need to listen to their heart and their lungs. Okay? When I first come in, I'm going to look at their general color to see what the skin color is. Are they cyanotic, blue looking, where they're not getting enough perfusion? I'm also going to take and look at their skin on their hands and on their feet. And if you have trouble with circulation, it usually will start first in the extremities. Also do what we call a capillary refill, and all you're doing is smashing your finger, and it should go back within 3 seconds, and if it does, that's a sign you have good perfusion, good circulation going on. If it's longer than 3 seconds, it's a sign you've got trouble with circulation. So we've done this general skin color check, we've done the perfusions on the hands and on the feet. We also want to go ahead and look and see if they have any swelling or edema in the extremities especially. And while you're down here, go ahead and do your pulse checks. You can take and do the pedal pulse, which is right on top. And in order to check an artery, you have to have a bone near the artery where you can mash that artery against the bone. So I've checked the pulse, and this is the dorsal pedis, or sometimes you hear it referred to as the pedal pulse. You want to do the posterior tibia. That's directly behind the inside of the ankle. And you always check both sides. You're comparing. Your book has got the amplitude or the strength of the pulse, 0 through 4. And of course, if we had a 0, we'd be in big trouble because we'd have no heartbeat. 1 is very weak, 2 is considered normal, and 3 and 4 is more pounding, where you can actually barely get your hands on it. It's a really good beat. So we've done the pulse checks here. We usually don't do the popliteal. It's one of the hardest ones to find, and routinely we do the posterior tibia inside the ankle, the dorsal pedis. We also will come up and do the femoral pulse, which is find the groin. It's midway there. And by the way, remember, you don't want to check a pulse with your thumb because you've got a pulse in your thumb. You want to check their heart rate. Okay? Check both sides. And again, we're doing it because we want to make sure we've got equal amount of amplitude strength going on both sides. Now, when we get back up here, we can also check the radial pulse on the thumb side. And again, they can put their arm up and hold it over, or you can circle around to the other side of the bit, whichever you want to do. And you want to check the radial pulse. Check the brachial pulse also. And we're not counting, we're just checking for the strength of the pulse. Okay? So we've got the brachial. You can also check the carotids, but don't check them at the same time, because if you put pressure on both sides, and if it's enough pressure, you can occlude the blood flow going to the brain. So that's your pulse checks there. So now what I'd like to go into right next is actually just watching the chest rise and fall. What I see on one side, I should see on the other side. And we call that symmetry. I'm looking, the respirations look nice and easy. It doesn't look like they're in any type of respiratory distress, meaning the nares aren't flaring, they're not gasping for air out of their mouth. You don't see the sternomastoid muscles bulging where they're struggling. You don't see any of the intercostal retraction that you'd see in a child or someone that's very thin. Okay, once you have actually inspected and see the symmetry, then what would be best, if they can, is to get them to sit up. If they can't sit up, get them to turn over towards you. And what you want to do is listen to the heart, the lung sounds. So we're just going to turn him over. You okay? Now, what you want to do here is you want to find the scapulars, and you want to listen inside the scapulars. So I would start, and what I do on one side, I want to do on the other side. I'm listening, go to the other side, and stay inside the scapulars. Don't get on the scapular because it's hard to hear through a bone. And then just compare. Have them take slow, deep breaths. Now, sometimes an older person will take and hyperventilate on you, and sometimes the younger ones too. But the older person is not able to tolerate blowing off all that CO2. They usually will have lightheaded and dizziness much quicker than a younger person. Okay? Now, what we want to do is turn them over. You've listened to both sides. And now, we want to try to keep them covered up too. What you want to do is come to the front. Doing okay? All righty. Now we're going to take and go, and we're going to listen to both sides of the lung going down. The intercostal space, and I'm listening here. Listening here, and they're taking slow, deep breaths. Okay? And I come all the way down. The ladies, you might have to lift the breast up to listen underneath. And remember, you want to go off to the side and listen to the lateral lungs also on that side. The breast sounds there. Okay? So we sound pretty good with the lungs. I don't hear any rales. I don't hear any rhonchi. I don't hear any inspiratory or expiratory wheezing. So pretty much I'm finished with my lung assessment, and I'm getting ready to listen to my heart sounds. Now, if you want to start on your, basically on the right and work your way over, your S2 is going to be on the right, mid-clavicular, the clavicle, midway. Come down to the second intercostal space, and you can hear your S2. Come over to the left side, find the clavicle again, mid-clavicular, usually in line with the nipple. Come down to the fifth intercostal space, okay? Mid-clavicular, and you want to listen to S1. So we have S1 and S2. Now, once you finish with that, we can cover their chest back up. Now we want to take and do the abdominal assessment. With the abdominal assessment, the first thing you want to do is just look. You want to see that what I'm seeing on one side, I'm seeing on the other side. You're looking for scars, any type of bulges, any type of abnormality there at all. So both sides should be the same, though, what we see. Once you inspect, then you want to auscultate, meaning I want to listen to all four quadrants. When I'm listening to these four quadrants, you've heard your stomach growling. That's bowel sounds. That's your peristalsis. Okay? It will either be absent, it'll be active, hypoactive, or hyperactive. As you go along, you'll learn to distinguish between active, hypoactive, or hyperactive. But I'm going to listen in all four quadrants. The thing about putting no bowel sounds is you have to listen in each quadrant, each of the four quadrants, for a full 5 minutes before you can document no bowel sounds. So we're going to say we're pretty good on the bowel sounds today. Now, the next thing you want to do is ask if they have any discomfort or pain in the abdominal area. Gently palpate, very gently, and see if it makes it worse or makes it better. And hopefully, if they're not having any pain at all, they're going to tell you there's no discomfort there at all. Now, what we've done with this second part of the assessment is actually did our lung assessment, chest and lung assessment. We did the abdominal assessment, and we did the heart assessment. And you would finish this up, make them comfortable again, put the bed down, put the head up, however they want to be positioned, put their call light in reach, put their table back so you can put whatever they want there so they won't be reaching and falling out of the bed. And then you would wash your hands, and go document.